What is a trauma center? What makes them different? When did modern trauma centers become established? And much more. I'm Dr. Joe Sucher with the Arizona Trauma Association, and this is Trauma in a Flash. The modern American trauma system is an incredible achievement that can be traced to a number of larger-than-life surgeons, important legislation, and the commitment to excellence from national organizations such as the American College of Surgeons. In 1966, a report entitled Accidental Death and Disability, the Neglected Disease of Modern Society, was published by the National Academy of Sciences and the National Research Council. This report, coupled with funding by the National Highway Safety Act in 1966, were important steps needed to address the most common cause of death for those ages 1 to 44, trauma. The pioneers, visionaries, and fathers of the first American trauma centers are Dr. William Blaisdell at San Francisco General Hospital, Dr. R. Adams Cowley at the University of Maryland, Baltimore, and Drs. Robert Baker and Robert Friark at Cook County Hospital in Chicago, Illinois, all opening their centers in 1966 for the care of the severely injured. In 1976, the American College of Surgeons published the Optimal Hospital Resources for the Care of the Seriously Injured Patient. This report established criteria for categorizing hospitals based on the level of resources they could provide for the care of trauma patients. The American College of Surgeons Committee on Trauma, the ACSCOT, continues to update the criteria and provide for recurring on-site reviews of trauma centers to verify their resources and processes. The ACSCOT verification is a voluntary process. There are many well-established trauma centers that deliver high quality of care that are not verified by the ACSCOT. Additionally, the ACSCOT specifically does not designate centers. This is left to the state or other governing authorities. Finally, the rules and regulations behind trauma center designation vary from state to state. The following is a brief description of trauma center levels based off the ACSCOT criteria. This may be different than the levels as designated by a state. However, states generally follow the ACSCOT criteria. A Level 1 trauma center is a comprehensive tertiary care facility capable of providing total care for every aspect of injury. This includes 24-hour in-house coverage by trauma surgeons, emergency medicine specialists, and anesthesiologists, prompt availability of care in specialties such as orthopedic surgery, neurosurgery, radiology, internal medicine, and plastic surgery, having a surgical residency, producing original scientific or clinical research, providing leadership in prevention and public education to surrounding communities, and having a comprehensive quality assessment program. A Level 2 trauma center is able to provide all that is listed for a Level 1 center, minus the requirement of a surgical residency and need to produce scientific research. A Level 3 trauma center provides prompt assessment, resuscitation, surgery, intensive care, and stabilization of injured patients. The elements of a Level 3 trauma center include 24-hour immediate coverage by emergency medicine physicians and the prompt availability of general surgeons and anesthesiologists, and providing prevention efforts with an active outreach program for its referring communities. A Level 4 trauma center provides initial evaluation, stabilization, and resuscitation capabilities. A trauma-trained nurse is immediately available, and physicians are available upon the patient's arrival to the emergency department. Transfer agreements exist with other trauma centers of higher levels for use when conditions warrant a transfer. Finally, a Level 5 is similar to a Level 4, but may not be open 24 hours a day. However, the facility must have an after-hours trauma response protocol. The Trauma Centers of America continue to grow and evolve. In 2002, there were 1,154 trauma centers in the United States. 353 were designated as Level 1 or 2. Currently, there are approximately 1,800 trauma centers, about 450 of which are designated at Level 1 or 2. While more hospitals are able to provide high-level care, there remain significant gaps in coverage, affecting the lower socioeconomic groups the most. This issue is where the ACSCOT, the AAST, and other state and federal agencies are attempting to find solutions that optimize where trauma centers are located. Thank you for watching this week's episode of Trauma in a Flash.